We spent all last summer, I think 3 of us occasionally talked about, oh my gosh, we have to do it. It hurts like heck.
I had really put it off for the longest time because my first experience at the hospital was not positive. I really dreaded doing this again. And I knew that this building was coming along, and I knew that I wasn't going to do it until this building was finished. The orientation that I had 1 week prior, I voiced my concerns. Every concern that I had that I went away with 8 years ago. And none of that happened. They addressed every one of those concerns.
I think I made the decision when because I had taken the shots for 2 or 3 years. And after 2 or 3 years of the shots, it was the shots weren't doing any good anymore. I've always had a very good experience with Dr. Kuplik and his office, and they've always been very kind and considerate and courteous. So I came to him for my knee surgery. I was the first Medicare patient at Recovery Inn. They got their okay for Medicare on Friday, and I came over from the AMC on Saturday and stayed here 8 days.
We talked a lot. You came to the other facility a lot.
We had her surgery 3 or 4 weeks before I had mine, so I had her to tell me what it was like.
I did it in early October, and I'll grant you there was a lot of pain. But if you work hard, you work really, really hard for 3 or 4 months, and you say ow, and you hobble around, and it really gets to your core, it pays off. I'm 4 months out, and I am fine. I am fine. I've learned a lot. The joints like to be moved around. We particularly like to go to swim class, me and my joints. And it's harder, it's subtly hard work, but I'm better for it.
I had my surgery October 21st, and November 26th, I was in New York City during the blizzard, visiting my son, so I did well.
Wow, that's really, yes, that's
very well. And walking well.
I went into surgery at 7:30, and by 11:15, I was awake, able to get dressed, and was sitting up, and they asked me if I wanted lunch. And I couldn't believe that I could eat lunch that close to having surgery. I felt fine. The pain was not there because they blocked it. I could sleep through the night, the first night, whereas at the hospital I couldn't sleep. I didn't think I was going to make it through the first night. The pain was so excruciating. It was a piece of cake. I can honestly say it was a piece of cake. I was very aggressive in rehabbing this so I could get home in 3 days. I was focused on getting home in 3 days, and I was able to do it. I was self-sufficient. It was so much different than the first time around.
I remember visiting you, and the best part was visiting Bernie and walking in and seeing you in that big chair with that fabulous blanket.
The Recovery Inn was just top-notch, every inch of the way. It impressed me that they gave me this beautiful, soft comforter to cover with, and they even gave it to me to take home. The facility was beautiful. I felt like I was in my own home. I wasn't stressed.
I was kind of treated like a queen. I got a lot of attention, and very good experience. Felt like staying in a hotel.
I really look forward to my next surgery, I guess, as long as it's an orthopedic surgery. That's a statement.
To look forward to surgery?
That's right.
I just think the concept here, the thinking is absolutely right on.
Dr. Kuplik's office told me that they don't have a building like this except on the West Coast. Other orthopedic surgeons have started this on the West Coast, but it's the first time anywhere else in the country.
State of the art, it's maybe where medicine is headed.
I think it probably is.
And who wins? We win. The patient wins.
Exactly.
I think we do.
There's something about the size of the facility too. I think the home-like atmosphere, being able to, once you do feel a little better after surgery, you can go down to their little restaurant and have your own little meal with your family down there if you care to.
Yes, and that means so much.
And they do go to the grocery and get something special if you want it.
Yes, they do.
That's just amazing.
It's kind of the individual attention that you get that you may not get in a hospital setting.
Individual attention.
Yeah.
That sums it up.
I would certainly come back here again when I have to have my other knee done down the road, maybe.
I've got nothing but praise for this facility. They focus on orthopedics. They've got no other type of medical situation to focus on. And they do a super job.
I think when you're at ease, in a pretty, comfortable, confident atmosphere, you're going to get better faster. And I think we all do.
I certainly agree.